Many patients with head and neck cancer require radiotherapy to achieve cure of their tumour. We know that as a consequence of giving radiotherapy to these patients, that the majority of them with conventional radiotherapy treatments will end up with very reduced saliva flow, dry mouth, problems with speaking and swallowing as a consequence of that. And the trial was designed to test a new form of radiotherapy called intensity modulated radiotherapy, to see if we can reduce the salivary damage and improve those patients' quality of life and avoid these side effects which are currently experienced by patients.
Tell me about IMRT, intensity modulated radiotherapy. What exactly is it?
Well, intensity modulated radiotherapy is a much more focused way of delivering radiation to the tumour, thereby avoiding some of the salivary tissue, which hopefully would then recover after treatment. So with standard radiotherapy for a head and neck tumour, usually lateral fields are applied from both sides of the patient's head, which covers the tumour very adequately, but also damages the saliva glands which are situated on the cheek on both sides. With intensity modulated radiotherapy, we bring in multiple radiation beams from different directions around the patient, and by doing that we can swerve the radiation dose around the salivary glands, allowing them hopefully to regain function after treatment.
Tell me about the trial.
So we randomised 94 patients. All the patients had tumours of the throat, mostly tonsil or tongue cancers. Patients were allocated either to the standard radiotherapy treatment or to the test arm of the trial, which was intensity modulated radiotherapy. We had very detailed assessments about patients, both what the doctors felt the patient said to them, also what the patients reported independently in quality of life questionnaires. So the study showed that both the patients' reported rates of dry mouth were drastically reduced by 60% at 18 months after radiotherapy. We actually collected saliva from the mouth of all of those patients, both before they started radiotherapy and afterwards, and that confirmed that saliva flow was maintained in IMRT-treated patients. And then thirdly, we had independent patient-reported quality of life questionnaires with specific questions on individual symptoms related to oral health. And again, the study in that component showed improvements as well.
And what's going to be the impact of the results of this trial? How soon could we see this new treatment being available to patients generally?
We've had a lot of interest in the UK and from abroad. So in the UK, 6 radiotherapy centres participated in the trial, entering patients and randomising them. And we now have further IMRT trials going on in other tumour sites in the head and neck. For example, the current COSTAR trial funded by Cancer Research UK is recruited so far 20 out of another 84 patients in a new trial. And we've now got 12 centres randomising patients in that trial. And we've got a third trial planned to start in 2010, and we hope that we'll have over 20 radiotherapy centres in the UK who are able to deliver this new treatment now.